Hi there. Welcome. My name is Calliope, and I am going to be performing your head to toe assessment today. How you doing today? I see. I hope by the time you leave this assessment, you feel even just the littlest bit better. So, let's see what we've got for you today. Looks like we are going to be starting right at the scalp. Just taking a look at the head, the skin of the head, the hair. Do some neurological tests. Look at your eyes, ears, nose, mouth, throat. Your extremities as well as your chest and abdomen. You have any questions before we begin? Excellent. So, if at any point anything is uncomfortable or painful, or you want to take a break, just let me know. So, do you mind if I start with your head? Okay. Let's just take a little peek. Just looking around the hairline to start. And then we'll get out a special tool to aid in assessing your scalp. So let me do a bit of palpation here, just to feel for any lumps, bumps, and the general shape of the head. Good. Good. Okay, so let me show you this here. So we have a lighted stick tool, which is excellent for parting the hair and getting just a little bit of light so that it doesn't overpower the scalp and doesn't bleach anything out. So let me switch to our lighted one here. Just a nice, cool light, just a little bit. And we're going to look around with this. There we are. It's quite cool out there today, isn't it? Yes, it feels properly like autumn. And about time too, huh? October. Don't mind the office cat. He has really been into a little plushy ball, and he only likes to play by himself, so when he does, he gets very rowdy. He's an odd one. His sister loves to run around and play all the time. He is extremely lazy. Extremely lazy. He's got a PhD in chillin'. Just kind of carding through the hair. Looking for lesions, looking for abnormalities on the scalp, areas of erythema, any little areas that we could quite pleased with that. Why don't we move on to a few neurological tests? So I want to start with your 7th cranial nerve. This is the facial nerve. I am going to have you just repeat some expressions so we can test the motor function of the facial nerve. So if I could have you raise your eyebrows, bring them down, raise the eyebrows, bring them down. Good. Raise one eyebrow. Can you raise the other? Okay. Close the eyes real tight. Open them real wide. Good. Close them tight. Open wide. There you go. Can you smile real big? Can you frown? And puff out your cheeks. Very good. Now, I want to look at the sensory aspect of your trigeminal nerve, cranial nerve, number 5. To do this, we are going to employ the use of a toothpick and a cotton bud. Now, what I'm going to do is I am going to lightly touch different areas of your face corresponding to each branch of the trigeminal nerve. And I want you to tell me if you feel a sharp touch with the toothpick or a soft touch with the cotton bud. So let me just test this on your jaw so you know that this is sharp and this is soft. Okay? Close your eyes and tell me whether you feel the soft or the sharp touch. Sharp. Sharp. Soft. Sharp. Soft. Sharp. Soft. Soft. Sharp. Sharp. Soft. Soft. Sharp. Excellent. For the motor aspect of the trigeminal nerve, I'm just going to test your muscles of mastication, at least the superficial ones. So, could I have you clench the jaw? Unclench. Clench. Unclench. Good. And the temporalis muscle here. Clench. Unclench. Clench. Unclench. Good. Can you open the jaw and close? Open. Close. Okay, so the masseter muscles here. Right in here superficial muscles of mastication, as well as the temporalis muscles up here, respond great. And how was your temporomandibular joint as you opened and closed your jaw? I didn't hear any clicking or feel any odd movements. Okay. Would you mind just shifting your jaw to one side and the other? Just gonna listen. Okay. How was that? A little uncomfortable. Yeah. Just see, can you do that again for me? Okay. No, that doesn't feel like there's anything going on. Is it painful at all? No, just uncomfortable. Okay. Good. So, we are going to move on to a couple of neurological questions. Would you mind telling me where we are at currently? You happen to remember the exam room, or perhaps you just know the hospital, or even the wing? There we go. And the time of your appointment? And what are we doing today? What are we doing here? Excellent. A head to toe assessment. Perfect. Now, I want to just fiddle around a bit with your sinus cavities. So what I'm going to do is I am going to press along the frontal, ethmoid, and maxillary sinuses. Let me know if they're tender or painful. We're just going to do one finger to start here. Any pain there? Okay. Along the ethmoid. All good? Okay. And maxillary. All good. Now I'm going to tap along these areas, a little bit of direct percussion. Let me know if this is painful at all. Okay. All right. And that's all good? Excellent. So let's take a peek at your skin while we're here. And I am actually going to use our little light stick again for this. It's just a good little tool to wave over and pick out specific areas. And if I need a little extra look, I always have a little magnifying glass. So just hold still. That's perfect. And we'll start at the forehead here. Got just that little bit of light. Good. And just looking around for lesions, unusual spots, spots like moles we might want to keep an eye on. Looking for hyperpigmentation, erythema, areas of dryness, flaking, this, that, and the other. Good. Good. I appreciate you sitting so still and being so patient. The nose, along the nares, cheeks, and the sides of the face here. Good, and the chin, along the jaw. Okay, let's just take a look with a little bit of light and the magnifying glass, just to make sure. Just to make sure. Good. Very good. Okay. And then we can move on to looking at the lymph nodes. I'm going to start behind the ears. I'm just going to use my fingers to roll the skin in front of the ears here, underneath the jaw and the chin, the submental and submandibular nodes, and do the superficial cervical, deep cervical chain, anterior cervical nodes, one side and the other of the neck here. And then supraclavicular is going to be above the clavicle here. I'm just going to do a little bit of palpation here. Let's go ahead and take a look at your eyes. So I'm going to get in quite close here. Just look around the eyes and maybe palpate a bit around the orbit. But I'm not going to get too close to touching the eye. It's a little uncomfortable. So right around the ridge here, around the bone. Not any closer. Good. We have clear lacrimal glands. Looks like the sclerae are clear. The pupils, as I see them now, are equal and round. And I'm just going to pull your eyelids down so I can look at the conjunctival tissue. So I'm going to have you look up for me. Look up, 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 up. Good. Okay, now can you look down? Down, 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 down. There we are. Good. Good coloring there. So let me grab a light. And this will be quite bright. Now have you look right here, and we're going to check your pupillary response to light. Good. Just keep looking right here. Perfect. And how about from this angle? Good. And here. Excellent. And we'll just keep checking. Very good. Excellent. So, would you mind just looking at the wall behind me? Good. Just keep looking at the wall. I'll just look at your eyes. Good. And can you look at the picture behind me? Just look at the picture. Good. Okay. Let's test your eye movement. So, I am going to use a blue light here. I'm going to have you follow the tip of this blue lighted stick here. Okay. So, using your eyes without moving your head, just follow this light here. And this way we'll check all your cardinal directions of gaze. Go up and down, up and down. There we go. And to the side, up. And this is checking cranial nerves 3, 4, and 6. Oculomotor, abducens, and trochlear. And I'll just have you keep following this in and out, all the way over here, and in. Good. And out. All the way. And in. Good. Just following the tip of the stick. And out. And in. And out. Very good. Just keep following this. We're going to go diagonally up and down and up and down. Good. Up, up, down, down. Wonderful. Now let's grab our regular light again. And we're going to check your direct consensual response. So, I'm going to put up my hand between your eyes here, and I'm going to shine the light in one eye at a time. I'm going to check both eyes, the one being shined into, the one that's not, and each time they should react the same way. So, I'm just going to pop my hand right here, and if I could just have you look straight ahead. Okay, so this is the direct response. This is the consensual response. Direct, direct, consensual, direct, consensual, consensual. Good. And we'll just switch right there. Direct, consensual, 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 direct, direct. Excellent. Now, let's take a look at your ears, shall we? So, I am just going to take a little peek and feel around the ears a bit. Let me know if there's any pain or tenderness at all. Just look at cartilage and the skin, and look for any lesions behind the ear or around the ear. Good. The other side. Good. Yeah, behind the ear. Okay. Good. Any pain or tenderness at all? Excellent. So, let's grab the otoscope. And we can take a look inside of the ear. So let's go ahead and just look right in there. There we go. So we are just taking a peek. Taking a little peek here. You have any issues at all with your hearing or with your ears? Okay. Alright, and any history of any ear issues? Alright. Okay. Looking just fine. So far, the ears are a very small area, so it doesn't take much time at all to look. So we can look at the other side here. Okay, and there we are. So, the tympanic membrane is intact. The ear canal is clear, good coloring. The tympanic membrane is good coloring. No signs of erythema, no signs of infection, discharge, anything like that. And you mentioned you haven't been having any hearing problems either, so don't have anything to look for there. But got our landmarks, and it all looks pretty good. All looks pretty good. So, I know you mentioned you don't have any issues with your hearing, but I would like to just do a brief little hearing test. So, if you could just tell me what word you hear in this ear or this ear. So, just repeat the word that I say. Orange, abstract, modern, plastic, bowl, And did those all sound clear to you? They did. Excellent. So let's go ahead and come down to the nose, mouth, and throat. So very first thing, I just want to have a little look at your nose. So we'll look at the outside just for a moment. Good. And looks normal, no swelling, no deformity. Can I have you tip your head back so I can look inside the nasal passages? Okay. We're not going to go in at all. We're just going to look. So, the septum looks good on this side, as well as the tissue and the turbinates, as well as on the other side. It looks like the septum is midline. No blockages. Nothing like that. So, I'm just going to look at your mouth, your lips. Looks like we are getting a little bit of chapping, but that's par for the course this time of year. It's funny how we go from an entire season where the skin has no problem with moisture, and the moment it drops below a certain temperature, everything dries right up. And if I could have you open your mouth so I could look at the corners of your mouth. Good. Good. And just keep your mouth open for a moment. And let's look at the teeth. As well as the buccal mucosa. Can you lift your tongue to the roof of your mouth? Good. And stick your tongue out as far as you can. There. And can you say ah? Good. Uvula's midline, and that's normal. Just looking at the pharyngeal wall. Looks non-irritated. Smooth. That's good. So, the uvula, the saying ah test, is for both cranial nerves 9 and 10, but we're going to do one more test for the both of them. So if I could have you just take a dry swallow, and while you do that, I'm also going to be feeling around the thyroid area. Two birds, one stone. So, if I could have you just take a dry swallow here. You can take a moment if you need. Good. Good. Okay. So, that looks great. Now, let's go ahead and do a couple of tests with your nose. So first, we're going to do a little breathing test. I'm going to occlude one side of your nose, and I'm going to have you just breathe through the other nostril for a few breaths. I'm going to occlude here. And just take a breath in and out. Breathe in and out. Good. Breathe in and out. Breathe in and out. Okay. And just a couple of breaths unobstructed. Breathe in and out. Breathe in and out. Perfect. Did you have any issue with breathing through one nasal passage or the other? Very good. Now I have a few scents here so that we can test the olfactory nerve, the sense of smell. I just want you to tell me what you think the smell is. So we'll start with this one right here. You tell me what that smells like. That is cinnamon. Very good. Very classic. And what about this one? Okay. Isopropyl alcohol. Very good. And this one. Yes, very medicinal smelling clove. Very good. Okay, and how about this one? Citrusy. Lemon, yeah. Last one. Let's do this one. Don't sniff too hard. It can be a little overpowering, rather. Garlic, very good. There we are. So, let's go ahead and look at the neck. So we looked at the thyroid, but I want to look at the trachea as well. We want to look at the carotid arteries. Just going to gently look at the borders of the trachea, make sure that's midline. Which it is good. No deviation here. And the thyroid felt just fine. Cricoid cartilage here. Good. So we are going to take a listen first. Make sure it's safe to palpate along the carotid arteries. So I'm going to have you take a breath in and then hold it so that I don't hear the air rushing in and out of your throat. If I could just have you take a deep breath in and hold. And exhale. Other side. Deep breath in and hold. And exhale. There we go. Good. Okay, so no bruise. No audible murmurs there. And I'm going to now palpate because we don't have any murmurs. I'm going to do one side at a time. So, there. And just breathe normally here. Only take a couple of seconds. Just feeling the strength and the rhythm. The other side. Okay. Perfect. So, why don't we go ahead and move down to the arms. First thing I want to do is grab some reflex tests here. So, this is a buck hammer. And we're going to be using this end of the buck hammer. And we are going to get the biceps and triceps reflexes. Would you mind just letting your arms hang nice and loose? Don't want you to tense them up at all. Just let the shoulders go and just let them relax. Okay, let's start. triceps on the back of the arm. Just let this go loose. Okay. And then biceps reflex. Just crook of your elbow. And I'm going to put my thumb in the crook and tap on my thumb. Just relax. Just like that. Now we get that little bit of muscle response. Other side. Let the arm relax. Good. And crook of the elbow. Let the arm relax. Just let it relax. There we go. Good. So, let's take a peek at the arms. So, check the temperature real quick. The backs of my hands. And everything is warm to the touch. Look at the arm and shoulder. Down to the forearm. Good. You show me the backs of your arms here so I can look for any plaques near the elbows. Good. Okay. Relax the arms. Let's look at the hands. So, the thenar and hypothenar muscles are well developed. We do not have a contracture on the palm, no palmar thickening. On either hand, if we flip them over, skin's just warm to the touch and dry. Normal coloring. And I'm just going to really quick pinch each finger to check capillary refill. Look at the nails, which we don't have any cholesterol deposits. And the nails themselves look good, no spotting, no banging on them. Those little white bits, little white spots, if you had hit the nail somewhere. Good color. Nails themselves are strong, not brittle. Although we've got a couple of hangnails starting there, so another product of the dry weather. Yeah, good. No, that's quite good. So, let's do some range of movement testing. We're actually going to come back up to the head so we can get cranial nerve 11 and then just work down. So if I could have you move the head up, hand down. Good. One side, the other. Tilt to one side and the other. Any pain or restriction with that? Good. And give the shoulders a couple of shrugs. Excellent. Can you lift your arms above your head? And try to bring them all the way back. Come from the side and lift them above the head. Very good. Move the shoulders back and forward. Good. Can you bring your elbows or your arms at the elbows up and down? Good. Can you rotate them in and out right along the abdomen? Okay, good rotation. And wrists, roll them in, roll them out, up, down, in, out. Splay the fingers, close them into fists. Very good. Okay, that all looks great. Now, let me just check the pulses real quick, and we'll move on to the chest. So, we have the radial pulse, the ulnar, and the brachial. So, we're going to feel each pulse and just assess the strength and quality. Let's find the brachial here. There we go. Okay. And radial, ulnar, and brachial. Good. Let's go ahead and look at the chest wall for a moment. And the chest wall looks normal, no deformity. Everything's in the right place. Ribs look good. They're in the right place. Okay, so let's take a little listen. I'm going to start with the lungs here. Take a deep breath in and out. 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 Good. Real quick, I'm going to do some palpation of your heart before I listen to it. So we're going to feel for any heaves with the heel of my hand. And then we're going to feel for thrills, which are palpable heart murmurs, with the flats of my fingers. Good. And then just breathe normally here. Just take a few moments, listen to the aortic valve. And the pulmonary valve. Tricuspid. And the mitral. Perfect. Okay. So, we are just going to take a quick look at the abdomen, and then we'll do a little auscultation. So I'm not going to touch just yet. Just want to see how everything looks. The skin's the right color. If there's anything odd, but there's not. So you're going to keep breathing normally here. And I'm just going to listen around the abdomen. Listen for digestive sounds. And we can listen to the renal arteries as well. Listen to the blood flow. Okay, one kidney here. And listen to the other artery. Okay, so now we're going to do some palpation here, which might be a little bit intense. So we're going to start light, and I'm just going to use one hand to feel around. I want to feel the spleen, the liver, see if we feel the kidneys, make sure everything's the correct size. There's no tender spots. And please let me know if anything is painful or tender. Okay, now for the deep pressure, I'm going to have you breathe with it so that I don't accidentally punch the air out of you. Okay, so deep breath in and out. Good. Deep breath in. Deep breath in. And out. Deep breath in. And out. Good, so that's all 4 quadrants there taken care of. Now let's finish up with the legs. We are going to do our reflexes first. So we have the patellar reflex. If I could have you just let the legs hang loose, just like we did with the arms before. Good, and we'll just hit this a few times. And the other side. Good. And then if I could just take a look here. So a lot of our skin abnormalities are going to be found on the shins. But we're going to check the thighs as well. The knees. And the feet. The other side. Any issues with your feet being quite swollen, or any issues with leg pain? Okay. Good. Alrighty, so let's feel some pulses. We've got popliteal on the back of the leg, back of the knee rather. Okay, can I see your foot here? Alright, so we've got post-tib, the ankle, and dorsalis pedis on the foot. While you're here, I'm going to check the capillary refill. Each toe, make sure circulation's good. And I'm going to check for any pedal edema here. And up to the ankle. Good. And other foot. Okay. So let's do post-tib. Dorsalis pedis, capillary refill, good, and then we can look at any edema. All right, put your foot back down and we'll look at the popliteal pulse for this leg. That one's a little trickier. You have to use 2 hands for these. Sometimes they're not palpable. Okay, so that one wants to be... Oh, no. There it is. That one wanted to pull a little sneaky. Alright, last test. we're going to check range of movement. Can I have you lift your thighs off the table and back down? Back down, down. Can you turn one leg out and back in at the hip and then do the other? Good. Can you kick out your legs, your shins rather, at the knee, back and forth? And with the ankles, can you move your feet up, down, in, out, rotate in, rotate out? Okay, very good. Did you have any questions at all as we finish this up? Okay, so we had the head, eyes, ears, nose, mouth, throat, neck, arms, chest, abdomen, legs. We got everything we needed. That looks good. So, I would like to thank you so much for coming into the hospital and having this examination. Everything looks excellent. Don't have anything that you need to worry about. No notes. All good. All right? I hope you have a whale of a day and a good rest of your night. Thank you. Thank you so much for watching. I really appreciate it. And a big thank you to my patrons on Patreon, without which I wouldn't be able to make these videos. If you'd like to help support the channel, I have a link to my Patreon in the description box below. I offer perks like early access to videos, ad-free access, Patreon exclusive videos, and audio downloads of all my content. Thank you so much for being here. I hope you have a whale of a day and a good rest of your night.